This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Philadelphia to Erie, from Scranton to Pittsburgh, it's Behind the Headlines. I'm Charlie Greenewald, Senior Fellow of the Susquehanna Valley Center for Public Policy, and I'm joined by my friend and fellow Susquehanna board member, Jerry Strickmatter, a former member of the State House of Representatives. Jerry, it's nice of you to fill in for Maura today. Maura's out on assignment.
Happy to do that.
Well, we're
looking forward to learning a lot today.
Happy to have you here. And what is, of course, one of the continuing major issues in Pennsylvania and Pennsylvania state government is health care and hospitals. And we have a great guest to talk to us about this today. We have Mr. Jeff Bechtel. Jeff, welcome to the show.
I'm happy to be here. Happy to be here.
You are, Jeff, you are the Senior Vice President of Health Economics and Policy for the Hospital and Healthsystem Association.
Yes, long title, but that's correct.
How long have you been in that position?
3 months, so I'm very, very new to this position.
Okay. Well, there's an issue that has reared its head in Pennsylvania and other states that we'd like to see if you can help us with, and that is the whole issue of something called balance billing.
Yes.
I believe that there's lots of people in my family who've struggled with this issue.
Right.
Exactly, could you tell our viewers what balance billing is?
Yeah, it's a great question to kind of kick this off. Balance billing, and it's kind of a lot of permutations, so it's not a simple issue, but probably the best way to describe it is a situation where a hospital is in network with an insurance company. But a hospital-based physician, and two common physician groups are anesthesiologists or radiologists, may not be in-network. And just generally, what in-network means, if you're in-network, that means you've already negotiated rates, for example, and it's a very complex contract with an insurance company, but you're out-of-network, you have not established those rates. So if you go to a hospital, for example, for a procedure, and for whatever reason you're seen by a physician that is not a hospital-based physician that is not in network, there may be a situation where the provider, the physician, would bill an insurance company to seek payment, but because they're out of network, they would not receive all of their charges, for example. And then what would happen is that physician would bill the consumer for the balance, and that's you've heard the term balance billing, and they're referring to the balance between what the insurance company paid and what the physician is charging. And when that happens to a patient, and they're not expecting this, that's the term surprise billing. So that's commonly the situation, and we can get into, obviously there'll be questions about why this happens and how we can avoid it and what we can do about it, but that's the best explanation I can give. Does that make sense?
Yeah, thanks a lot for clearing that up, because when you first hear that term, it could mean a lot of different things.
Right.
But I understand what we're talking about today, so our viewers understand that. And certainly the other thing that makes it more complicated is, even though we're talking about today, unless they're sick and unless they enter the system for some reason, they're not going to be paying a lot of attention to it.
Absolutely.
It's only afterwards. So it was just like with the telephone industry, telephony. Deregulation hit over a period of maybe 20 years, depending upon when they wanted to change. Same thing here. This really only impacts our viewers when you get sick or a loved one gets sick.
That's
and
correct.
then you have these large bills that come in.
Potentially, in these circumstances.
So
yes.
I'm really glad that that you're here to try to clear that up. What do you think the answer should be? From the major provider of healthcare to all the viewers. What do you think should happen?
Well, I think this is one of those complicated issues that involves, I think, a lot of different solutions. I mean, consumers obviously have a responsibility to make sure that they do their homework so they understand to the extent they can whether providers that they plan to see are in or out of network. But that's not always possible, and we can talk about why. There's certainly a role for hospitals, first of all, to provide information to consumers. And one of the things the hospital community has done has prepared something called, and I'll read it here because it's very complex, it's called the Principles for Operational Guidelines for Consumer-Focused Hospital Financial Services. And essentially, it's a document, a stake in the ground, where about 70% of Pennsylvania's hospitals have adopted these principles. And the principles essentially are designed to ensure that hospitals provide as much information about the financial interactions that they have when they enter the hospital. And one of the principles talks about this very situation. And the hospitals that have adopted these guidelines have committed when an individual enters their hospital to provide as much information about what the costs will be, the possibility that there may be some unforeseen costs, so they can be avoided up front. So that's the hospital community certainly has a role for providing information on this. But it's also incumbent on providers themselves, physicians, and insurers to provide as much information as they can. In many cases, though, a lot of states, as you mentioned, this is just a very difficult problem because despite all the efforts that I just talked about, these situations sometimes occur. So even if you do your homework and you're going to go in for a specific surgery and you're sure that your anesthesiologist is in network, the surgeon is, there may be an emergency situation, there may be a delay in a previous surgery, or just through just the press of events or unavoidable circumstances when you do receive services from an out-of-network physician. So those situations are very difficult to deal with. And states have been adopting various legislative solutions. I think there's, over a dozen states have implemented legislation or policies to try to get at that. I can walk through those if you like.
These different plans that the various states are setting forth, are there parallels among them? Do they look somewhat similar, or are they wildly different, Jeff?
I wouldn't say they're wildly different. I think there's essentially 4 categories. And this gets into some detail, but I'll try to make it simple. One is just transparency measures, where the state can require insurance companies to make sure that their provider directories, for example, are up to date, or that providers provide the information to consumers, as much information as they can to make sure this doesn't happen. I think that helps, and that's something that is happening voluntarily, but it may not be the solution. Other solutions could be prohibiting physicians or providers from balance billing altogether. So they bill the insurance company, get paid what they can, and they're unable to obtain the balance that we talked about. As you can imagine, physicians don't like that solution. On the flip side, some states have adopted something called basically establishing a default rate. So in circumstances where it's a true surprise balance bill, that there is a rate established by the government for that situation. And depending on the rate that's set, it may be beneficial to physicians or insurance companies. The problem with the 2 solutions I talked about, the prohibition of balance billing or the default rate, is it's really interfering with the negotiations between a physician and an insurance company. It could potentially increase costs. There's a lot of unintended consequences that make that pretty unattractive to folks. So the 4th option, which seems, if you read policy papers on this topic, seems to be in favor, is a model in Texas and New York, where the state essentially establishes a mediation or arbitration process. So in instances where it truly is a surprise bill, the consumer is taken entirely out of the equation, and the provider and the insurance company are left to try to work it out. And absent an agreement, the case is sent to an arbitrator or a mediator. And I think the goal of this is to set up a process where it encourages providers and insurers to kind of resolve this amicably through negotiations and to take the consumer out of the equation. Again, there's a lot of devil in the details on how the arbitration or mediation is set up and whether it favors one party, providers or physicians, or another, the insurance companies. So you can imagine there's just a lot of issues.
Well,
there.
On behalf of the viewers, can't speak for all of them, but I believe they like choice.
Right.
They want to have low cost.
Right.
They want to be able to take care of their loved ones and themselves. And I think having a legislature, being a former legislator, you say that's not always the way that you want, because it's hard to change those.
Right.
It's hard to change those bills. As new things come along.
Right.
It sounds good, but I think a model like the 1-800, like all the utilities,
right.
they have a great interest in their infrastructure, so they have a number, a one-call number, that maybe the industry should get together, all those parts
right.
that you talked about, and come up with their own one-call number to find out, are these people in line? Am I in the right hospital? Am I looking at the right procedure? What happens if I'm on the table for my leg and all of a sudden I have a heart attack? What happens? And maybe that's the way it should be looked at, because when you throw it to the legislature, you have all these variables that you have the legislature trying to think of. And it'll be good for today, but what's going to happen 3 months from now? And are you going to get the legislature together to amend the law?
Right.
So
these are difficult issues.
So I just ask you, do you agree with those issues, or because you're the policy expert, or do you think they've already been looked at, and that what would you suggest, or what would your association suggest?
I don't think we have a position on this yet. We're exploring all of these issues. We understand it's a complex situation, and certainly we expect that all of this is the beginning of the conversation. There was a hearing held recently by the insurance commissioner, Teresa Miller, where it was an all-day session, essentially.
Here in
Harrisburg. And provider groups testified, as you can imagine, but a lot of advocates and consumers. And it became pretty clear this is an issue, a serious issue in Pennsylvania, and there's a lot of interest legislatively to deal with this. I think I commented a bit on some of the pros and cons about this. I don't think we have a position. Just one observation, though, is that the prohibition on balance billing solution or the default rate solution, that's a situation where government is getting involved in negotiations and kind of setting a rate. The arbitration mediation model, and this isn't an endorsement, but it's really establishing a process, not mandating a certain payment rate. So it's something that certainly deserves, and it will, I'm certain, get a lot of attention.
Well, Jeff, you talked about a variety of other states. Here in Pennsylvania, could you try to share with our viewers, what are Pennsylvania hospitals doing to deal with this issue?
Well, I talked about it a bit. I think the primary initiative is the guidelines that we talked about. It's something we're promoting, and there was an enormous interest, of course, by hospitals. 70% signed off on these guidelines. And the key focus, at least in regards to this issue, is talking to hospital patients about this topic. To make sure that they're aware that this could potentially occur and take as many steps as possible to avoid it.
One quick question for you.
In the last 15 seconds.
Right, the last 15 seconds is, give us your website number, because you talk about these guidelines, you talk about these other facts. You don't have to say it twice because it'll come up on the screen. But if you could let our viewers know where this is going to be and where they can get in touch with you.
Absolutely. It's, I think, www.haponline.org.
Thanks.
Very good, very good. Well, thank you, Jeff. The time went way too quickly.
Oh, my goodness,
we
yes.
have to have you back to talk about this.
I was surprised because it was...
we're just scratching the surface.
We are.
Well, we want to thank you very much, and we'll be right back after this message. Stay tuned.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The council works aggressively to define key long-term policy strategies and solutions to make the commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States, and by Blackford Ventures, LLC, a private equity firm seeking to make significant investments in real estate, proven business enterprises, and their leaders. Find out more at www.blackfordventures.com. and by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. On this segment of Behind the Headlines, Jerry and I are going to be talking about Pennsylvania clean power. And on this particular segment, we're lucky enough to have one of the experts in the Commonwealth on this subject, Abby Foster. Abby, you are the Director of Communications and Advocacy for the Pennsylvania Coal Alliance. Welcome.
Thank you. Thank you for having me. It's an important time in Pennsylvania's energy economy right now.
Well, we appreciate you coming here and spending some time with us. Before we get into Pennsylvania specifically, some of the statistics that I've dug up last week on this particular subject was the final rule for the Clean Power Plan released by the Obama administration in August of this year represents a direct attack on the coal industry. The final plan, supported by, in fact, Senator Clinton, will close 66 power plants, eliminate 125,800 jobs in the coal industry. The industry will shrink by 48%, and this will cost, if we lose 125,800 jobs, this will cost the people of the United States $9.8 billion per year in lost wages. This is a profound rule, isn't it?
Sure.
Makes a big difference in our economy and how we go about this. Jerry?
With those facts there, I know that's talking about August, Charlie's talking about, but maybe you can tell our viewers, how does this even line up with what's happened before? How many have already been closed on this war on coal?
Sure. So this isn't the first EPA regulation that's come down on coal-fired power plants. The mercury air toxins regulation was set about in 2011, and coal-fired power plants are still in the process of complying with that rule. Multi-million-dollar investments into power plants. Nationwide, there were 400 coal-fired power plants that were shut down in 36 states. In Pennsylvania, there were several coal-fired power plants and several hundred jobs that were lost. The kicker is that in June of this last year, the mercury air toxin standard was found by the Supreme Court that the EPA did not consider the cost of compliance. They didn't do a fair analysis on actually complying with the rule and what it would cost utilities and consumers, and the rule was remanded back to the D.C. Circuit Court. This is really important to note because this new regulation will be much more costly than the mercury air toxin standard, the rule on carbon emissions, the Clean Power Plan, because it's not just using available technology to retrofit coal-fired power plants. It's actually transitioning away from current coal-fired power plants to other sources. So you've got infrastructure that you have to build. You have subsidies for renewable energy that you have to finance in order to get them into the market. It's transitioning away from coal-fired power plants before their lifespan is done.
Mm-hmm. Well, before the Clean Power Plan can take effect, it has to be, I believe, published in the Federal Register 3 times, and that has yet to happen. And Pennsylvania's been sort of leading the way, trying to get out in front of whatever's going to happen. The Department of Environmental Protection here in Pennsylvania had set up 14 listening sessions around the Commonwealth. What happened with those listening sessions? What did DEP hope to accomplish by doing this, and what has been accomplished, Abby?
Sure. So on October 23rd, it actually was published in the Federal Register, and it's good to note that EPA took so long to publish it because they're kind of running the clock on the states right now. It's a little bit of a game they're playing. Lawsuits can't be filed until it is in the Federal Register. Since its filing just a couple weeks ago, 27 states have filed suit, 24 national associations that represent 80% of the economy. You've got the National Association of Manufacturers, National Federation of Independent Businesses, as well as some labor unions and companies have filed suit. They've requested a stay, which we should have a result on sometime in January. But it's definitely an issue that is dividing the country, more so against EPA than for. And since before it was even published, DEP set about to comply, and they hosted the listening sessions statewide. There were 14 of them, and a 60-day open comment period on how Pennsylvania should comply with this rule. They were very technical questions, rate versus mass compliance, whether they should do regional trading, interstate trading, intrastate. But there was definitely a good showing around the state. Over 1,000 comments and testimony were given to DEP, and I actually have gone through all of them. And there was a good majority of people were pro clean power. that's a very easy polling statement. If you ask the general public, do you want clean power? Of course. But there is a cost to consider with complying with that. And when you ask people, do you want clean power and will you pay an extra 20 to 30% for your electric bill, they say no. So there was a good showing from the coal industry at these listening sessions and for testimony. From the IBEW represented the workers that jobs would be lost. Legislators, utilities came and asked for the 2-year extension so that costs could be considered. And you had, of course, the manufacturers who rely on low-cost electricity and reliable electricity, and the PA chamber. There was a good showing across the state asking DEP to slow down and consider the impacts.
Mm-hmm. So besides cost, which I think is very important, and that needs to get out to all of our viewers, everyone wants clean air, and we certainly want it yesterday. And I believe that the standards have been improved and that the air is cleaner than ever before. But as people see that their electricity bills keep going up and up because of this getting cleaner. At what point do you see, as people across the state could contact their legislators or contact their congressmen, since obviously you've pointed out that this is a federal and a state issue? What are the dates that would be important to consumers to know that will be impacting them? I know every month the price keeps going up because of these things in the past and what's proposed, but what key dates do you see in the future?
Well, you are correct that the air has gotten cleaner. Since the 1970s, the emissions from coal-fired power plants for the other regulated under the EPA National Ambient Air Quality Standards, those emissions have reduced 85% per electric generating unit. And during that same time, coal utilization for coal-fired power plants increased 163%. So the U.S. is doing a great job. Their coal-fired power plants are state-of-the-art. They're much better than other countries around the world. You can see in other countries they're developing coal-fired power plants, and the coal consumption globally grew 14% from 2008 to 2012, and that was faster than any other fossil fuel. In the same time, U.S. reduced their national emissions from carbon by 23%, while China and India increased by 30%, respectively. And then we found, New York Times just reported a couple weeks ago that China had actually had some errors with their statistical reporting, and it was 17% more than what they had actually reported. And 17% by China standards, that's actually, it's a big number. It's 70% of the total coal used annually by the U.S. And so this is not small potatoes. If the president's going into these Paris negotiations and we've got countries that are not transitioning away from coal, they're building their economies on it. But the air has certainly gotten cleaner, and coal-fired power plants have evolved as technology is available. That's what setting achievable regulations is so important, and that's what's missing here with this carbon emissions standard, because commercially technology is not available for retrofitting on coal-fired power plants right now. As far as dates going for contacting your legislator, under Act 175, which was passed under Governor Corbett, the Department of Environmental Protection has to submit the state implementation plan, how they're going to comply to the General Assembly 100 days before it goes to the EPA. So that's going to be around Memorial Day this year, if DEP is going to be submitting a plan by 2016, which they do not have to. There is an available 2-year extension that they could take advantage from. So they could contact their legislator when the state implementation plan goes to the General Assembly. I mean, it's always good to keep your legislator informed on these issues. We just had a hearing this past Tuesday on the 17th with the Coal Caucus, and there were about 30 legislators that came. It was the impacts on the coal industry and associated industries. We had a timber industry, a couple of the men and women from the industry that were working in jobs, and it's important to note that the trickle-down effect is real in Pennsylvania. So it's not just a regulation on coal or coal-fired power plants. This is on railroads. At one of the listening sessions, R.J. Corman Railroad testified that they had seen a drop 43% year-to-date on their revenue because about 68% of Pennsylvania coal is shipped around on railroads. It's a big impact industry, and it's deeply embedded in Pennsylvania's economy.
On Tuesday, November the 17th, in the U.S. Senate, the U.S. Senate took some action on this issue. What did they do, Abby? Could you tell our viewers what happened there?
So under the Congressional Review Act, they had 2 resolutions, and one would be able to repeal the Clean Power Plan. Unfortunately, the president has already issued a statement saying that he will veto, but it is very telling to show that he is going into these climate negotiations with other countries, and he doesn't have his Congress behind him on this. They understand the impacts on both ratepayers, on the economy, and on the jobs in their districts.
That's not unusual, since the president said he was going to close them all down,
right.
and he had this, war on coal. So I guess our viewers sort of know how this is stacking up, and unfortunately, you're giving us the bad news that this is what's costing us, and what it is going forward. What would you estimate the cost, to the people, that use electricity, which is everybody in our
right,
Commonwealth?
Right.
What do you think the cost would be?
It's one of the very attractive things about Pennsylvania for businesses and for manufacturers. We do have a really great, diverse electric portfolio in Pennsylvania, and that is wonderful because when there is a big spike in demand, that we've got natural gas, coal, and nuclear. Those are all baseload suppliers of electricity that ensure that there is not any brownouts. There are not any spikes that they can foresee and they can predict the market, and that's what makes Pennsylvania attractive for business. The Energy Ventures Analysis has done a study on the cost of compliance, and in Pennsylvania, they estimated that 13% to 26%. So 13% before the 2022 deadline for the first interim check-in compliance period, and then by 2030, which is when you're supposed to have your emissions completely reduced. For Pennsylvania, it's 34.9%. It would go up to 26%, and those are wholesale electric costs. It's important to note for wholesale electric costs that that's not just what you're going to get on your electric bill, because you have transmission costs that are factored in for every electric bill that you get. That's the cost of infrastructure, building pipelines, the money that's used for putting renewables into the market, and so it's going to have certainly a large impact on Pennsylvania.
Just as a follow-up, then, that doesn't make sense then as to why Pennsylvania departments would be going ahead trying to be the leader on this when we've been behind on so many other really good
right.
issues where we're usually 47, 48, 49, 50. But I think what I read was that Pennsylvania's looking to be number one. Is that true?
Right. It is. The Department of Environmental Protection has said that they would like to submit the plan by 2016. The problem is that once the plan is submitted, even if litigation wins out, even if its parts are overturned by a new president, it is legally binding. So Pennsylvania will have to be upheld to the 2022 deadline and the 2030 deadline, while other states waited and weighed the cost of compliance.
Well, the cost of compliance, and then we have to wrap this up. If the Clean Power Plan is introduced in Pennsylvania, some of the figures that we've seen, do you concur with these or not, that wholesale electric rates will increase by 13% by 2022 and 26% by 2030?
Correct.
That's a major increase in the cost of doing business, isn't it, in Pennsylvania?
Yes, absolutely.
And that'll, of course, that will trickle down to the individual consumers. Okay, well, Abby, we want to thank you so much for spending some time with Jerry and me this morning. And we want to invite you back to spend time with us again next week. We'll see you next week on Behind the Headlines. Tune in.